So we've combined the objectives 2 and 3 together. We want to clarify some of the domains of resiliency, because this is a word that's kind of thrown around pretty frequently. We talk about resiliency a lot with maybe if you're working with younger clients, youth and adolescents, resiliency just in the profession across a lot of ours, that do experience high levels of ongoing stress and burnout too. So I want to talk about what those techniques can look like moving from the individual resilience to organizational resiliency. So this is a nice diagram here, a visual to look at both the clinical and applies to kind of learning environment. So from experiencing stressors, both at an individual and an organization level, we have been kind of constantly taught, to attend to these individual skills to promote resiliency. And we often think that if all of us as individuals just apply these skills, the organization, as a whole would be resilient. And that's not necessarily, the context of these work in. So we'll admit that even in some of the earlier series of this training series, we were focusing a lot more on tools and kind of understanding individual employee wellness to improve the larger organizations, because it is a component of it. But we also want to talk about information that's really critically important too, is kind of a focus at the organizational unit. So not just as the employees and kind of individual level factors influencing that wellness, well-being and resiliency, but what are things actually at the organizational level? So think about policy, structures, individuals, that can foster a sense of resiliency in your organization. So according to kind of current evidence right now, organizations can overemphasize this kind of personal responsibility, So maybe an emphasis on the self-care emphasis is strong right now, resiliency factors. We've talked a lot about those wellness dimensions, and these are all important aspects of wellness, in ensuring that employees can come into the organization present. But if there are organizational factors that are negatively impacting that culture, in your workplace, or the ways in which we go about practicing, or working in this space, then it can mitigate or kind of negate, those individual strategies that we've been employing. So this model kind of transitions us from the individual and organizational resilience into this connection between both of them. So according to this model, the weakest link is not viewed as the individual inside of the organization, but it's actually looks at the weakest kind of bonds or connections between the individual and organization. So it talks about how it's the organization's kind of primary responsibility to promote this community of support in the organization, which you all already gave some examples of too, with the employee assistance programs, restructuring how folks access benefits. I love the example of actually having a wellness plan with your employees too. And so in this model, there's these 4 connectors between individual resilience and then organizational resilience. So we're going to walk through these connectors on these individual and organizational levels. So this top one, maybe this is something you've all heard before too, Communication, communication, communication. Individually, this would include informing leaders of individual and maybe group needs and potential areas of growth. So maybe this is coming out in some of those wellness committees that you guys were already talking about, voicing concerns within the workplace. And at an organizational level, this could be used to promote an open and kind of honest line of communication between leaders, supervisors in an organization, and then the teams of employees regarding issues. This could also be used, to do that recognition piece, praise of things that are going on well with employees and the organization, If you get a grant that's going to provide services to a whole group of clients that haven't had them before, celebrating those wins with your employees too, and recognizing work that's been put in to make those changes. And the other is sense of belonging. So I think we've talked about that a lot in the fields, of behavioral health and health too, the helping professions. Oftentimes these individuals, I think, as we, not big assumptions for the group or anything, but have a really strong tie to the profession, right? To the work that they're engaging in, wanting to make a difference in the lives of clients and patients too. And part of that then is seeking the sense of belonging. So at the individual level, people are often, right, seeking out personal connections with coworkers. At the organizational level, this could be leaders, right, promoting avenues for employees to connect. You all talked about organizing group gatherings, increasing, the community just within the team or the organization. And again, using this as an opportunity to show compassion for others, discuss some of the hard, life experiences, family experiences that could be impacting employees within the workplace, and also recognizing some of these larger influences, right? COVID-19 really shined a light on a collective experience of our employees during that time. And so recognizing some of those other things happening in the world too can be helpful. So hosting, like you all said too, check-in meetings with employees from the organizational level, and having those consistent kind of feedback communication loops for folks too, to raise concerns and then follow through to actually have those being addressed within the workplace too. The other right in the middle here is a sense of shared vision. So I kind of mentioned this a little bit earlier too, got a little ahead of myself. But at the organizational level, there's often, right, leaders might seek feedback on how we can achieve the organizational mission that's set out, or the vision that the organization or agency is trying to uphold, right? So leaders could utilize kind of reflective practices, like you all mentioned, some of them did wellness surveys. Maybe there's other forms of surveys or focus groups or ways that you all collect feedback and input from your collective teams. And then lastly here, this connection with the recognition of gifts. I think that wording might be a little interesting for us in our different workplaces. Maybe these are just small recognition, right, of events, birthdays, right, years of service within our different organizations too. But what else could this look like, right, in terms of encouraging leaders to identify, show interest, and kind of appreciate our employees' skills and talents that they're bringing to the organization too. Maybe you're recognizing folks for engaging in professional development or for mentoring students, right, in their practical experiences in your different organizations and agencies. And so this is really just getting at that. What are the ways that we're working to make employees feel important, acknowledged, and truly a part of the larger organization, and recognizing that they are a special kind of individual on our teams too. So with that, these are the dimensions within organizational resilience. So we see here, right, organizational resilience is planned, but also adaptive. It is not a one-size-fits-all model. You may not be able to implement and address all of these 8 categories at the same time, right? That might not be feasible for where your organization is. It also might not meet the needs of your employees either. So part of this, right, is just like the wellness of dimensions. A lot of these are overlapping, interconnected. So capital really talks about the resources, the social networks, how your organization is addressing or responding to some of these small and large everyday stressors, right? Then the system, as I mentioned before, what are the policies and procedures, processes that you all have in place that are part of a strong foundation in your organization? And what else, like what are the pieces that could be improved too? So for example, maybe just offhand, do any of you, have an example of a policy that supports maybe wellness or supports that sense of community or communication within your organization? This can also, right, include things like emergency procedures, maybe a clear outline, right, of how supervision happens in the workplace. For example, right, social workers have to be clinically supervised at certain licensure points, similar, right, for nursing, pharmacy, being supervised by a certain point. Also thinking about the role, right, we talk a lot really across our different professions about working interprofessionally too. So having some of these structures, policies, right, in place and laid out could help with that sometimes uncertainty or miscommunication, right, between who is the source of support in that organization. And this also involves this adaptive capacity of your actual organization, right? So the organization's ability to learn, assess your capacity to make changes. And then also, crucial to this is adjusting to changes and crises kind of as close to real time as you can, right? So if we're lingering on a widespread problem, that could then lead to maybe some dissatisfaction, right, from employees, maybe creation of some larger concerns around wellness then too. So of course, culture is something that we've hit on quite a few times now around how we can actually create an organization in a culture where people care about their jobs, they care about the work, they want to come in and contribute to that broader organization or agency too. And so really the the take home of all of this really, right, is that our organizations, we have to set them up to be a space where people feel connected to one another, to their employees, connected to their leaders, their supervisors, and working toward that shared goal or vision as an organization. Volunteers, folks who are not necessarily just employees and staff of our organizations too, community members maybe that are volunteering, providing resources, helping support our different initiatives happening in the community too. And then to kind of drive home as well, this is based on current evidence too. There's a lot of discussion right around burnout, and just overall, we've talked about ways, of course, we want to work on the prevention side of helping our health and behavioral health employees not become burnout in their profession. But at the same time, organizational factors, so part of these dimensions here, are the top contributors to burnout and they're the top ones. Up to 80% of burnout is caused by some of these organizational factors. So this mismatch between organization and personal values, commitments, differences, or harsh leadership styles, right? And some of these other lack of culture, warm and safe climate within that organization too. So kind of just a pause on that and think about your role right in your organizations too. What are some examples of how leaders, folks who have, even if they're not in a true, supervisory management role, what do leaders in your organizations do so far? Here we go. To promote this organizational resiliency. To hear from you all again, what are folks doing to promote a sense of resiliency in your organization? What changes have you made right in terms of your workplace policies, how you communicate with one another? So you're providing the opportunity for employees to have input, to communicate with the larger supervisors, leaders, and there's just kind of a widespread need for more support.
You see there's some in the chat. Check in with staff frequently, continue to get feedback with what would be helpful for support. That they receive yearly surveys where we are engaged to share concerns, not very personal. And then we have an outside facilitator that attends our team meetings to help our team work through workflow frustrations, etc.
Example too. So yeah, having these outside organizations come in, support, understand what the employee needs are, and kind of where to start intervening. Other thoughts around types of leadership, even preparation that you've received, or supportive kind of approaches to leadership, supervision that you've seen work well in your workplaces?
And have information provided or prepared and in place. We have days that the facility closes and have group sessions and trainings.
Okay, so a lot of discussion around professional development opportunities, definitely having these trainings, like you said, that are going to continue building the skills of your employees, confidence, self-efficacy to actually do, like you said, trauma-informed practices, or if there's other specific therapeutic techniques, or even in those medical spaces, right, for nursing, pharmacy, maybe it's more of the brief counseling around taking medications, following health and treatment kind of protocols too. What else?
That we are lucky that our supervisors are also mental health professionals, so they are acutely aware of some of the challenges that we face.
That is really helpful. So having a shared professional that that comes into a lot of different components: shared professional values, expectations, right, around training, supervision, alignment. How many of you folks are working with interprofessional organizations where you are supervising folks of different backgrounds or professions within your role too? Okay, I see a couple hands. Yeah, so thinking of ways that if it is possible, right, to have supervision with professionals of the same, background, that might be helpful. If it's not possible, maybe like you all said, you have these once a month opportunities to get consultation right from the same profession or additional training. And I'm guessing too, just from what you all have shared, that these are hopefully being informed by what your employees are sharing. So not just a top-down right leadership of, which can be a good process for some of them, right? If you know something's coming down the line, you're going to implement a training, you want your employees to be prepared to do that. And also getting feedback, like you said, from the employee level. What do folks need more support in? Where could resources be realigned if possible? What are other ways that you can reduce? I'm again, like you all know too, right? Is there any way we can reduce workload for certain individuals? Is there administrative work that can be streamlined? That's just based on some of the feedback too that we've gotten from trainings. Thank you all so much for sharing about your own experiences in the organization, and we'll see you next week.